Okay, variations in newborns. All of these that we're going to go over are normal. Okay, these are all normal things for newborns. All right, these are not things that parents should be too alarmed about, and all of these are stable, conditions for a newborn. Right. The first one, distended sebaceous glands that are small spots on the face are milia. Milia are distended sebaceous glands. Okay, and they're little white spots on the face. Milia. Epstein pearls, the second one, number 2. Epstein pearls are small cysts on a newborn's gums. Okay, they're epithelial cysts on the newborn's gums. Number 3, Mongolian spots are black and blue macules that are appearing on the glutes and thighs of darker skinned newborns. Okay, that's Mongolian spots. Number 4, it sounds really bad, but it's totally normal and totally stable. Erythema toxicum neonatorum. Right? These are benign red papular rash that are on the newborn's torso, and these resolve within the first couple of weeks. It's totally normal. Has a big scary name, but it's nothing that should alarm a provider or the parents. Number 5, hemangiomas are benign tumors of capillaries. Okay, hemangioma. Number 6, a cephalohematoma. Cephalohematoma is basically swelling that's caused by bleeding between the ostium and the periosteum of the skull. And it does not cross the suture line. Okay, it does not cross the suture lines. Cephalohematomas do not cross the suture lines. And number 7, caput cicadaneum is a self-resolving edematous swelling on the top of the scalp caused by pressure during birth, and this may cross the suture lines. Okay, it doesn't always, but it may cross the suture lines. And a lot of times people have a tough time determining which of the two this edematous swelling is, cephalohematoma or caput cicadaneum. And the way that I remember it is I don't say cephalohematoma, I say cephalnohematoma. So cephalnohematoma, it is no, because it is not crossing the suture line. Okay, and then the other does. All right, so you can think of it that way. Cephalnohematoma. Now, number 8, hyperbilirubinemia. And this is normal jaundice that appears within 24 hours of birth and then typically resolves on its own within a week. Number 9, vernix caseosa. C-A-S-C-O-S-A. Vernix caseosa. It basically looks like cream cheese substance that covers the skin on an unborn baby. Okay, that's vernix. Number 10, acrocyanosis. Acrocyanosis. And this is a normal bluing of the newborn's hands and feet. Appears immediately and then up to maybe the first week or 2 of a newborn's life. It's not totally out of the ordinary. Typically when a baby does not score a 10 on the APGAR score, the reason that it's scoring a 9 instead of a 10 is acrocyanosis, right? Bluing of the hands and feet. Not uncommon. And number 11, nevus, N-E-V-U-S, or nevi, plural and singular. They are genetic terms for birthmarks. Right? Now, remember, all of these are considered normal. All right? So when they ask you, the mother looks at her newborn baby and asks the nurse, I see these spots on my child, and you recognize them as being milia, you are going to tell the mother that the child is normal, that this is okay. Right? All of these things typically resolve on their own. Birthmarks are not going to resolve on their own, but they are normal. Okay, they're not out of the ordinary. So in the NCLEX, when in doubt on variations in the newborn, when in doubt, call it normal. Okay, if it's on this list, it's normal and they're stable.